Many of our calls from employers are to ask about how to set up a drug-free workplace program. The drug-free workplace program is the overall program needed for an employer to establish drug testing. Drug-free workplace programs include a comprehensive written drug-free workplace policy, employee education, supervisor training, access to employee assistance programs, and of course, drug testing. The comprehensive written drug-free workplace policy is the who, what, where, when, and how of the company drug testing program. It should be specific that illicit drug use is prohibited. It should also have very clear and specific consequences of violating the policy. Some companies have zero tolerance, and any violation will result in immediate termination of employment. Other companies provide an employee with the opportunity to seek treatment before initiating disciplinary action. And it's important to note that the employer should treat all employees consistently. The drug-free workplace policy can be written by an HR professional, an attorney, or a drug testing professional. Joe Reilly at National Drug Screening has been writing drug-free workplace policies since 1999. He works with companies large and small to develop comprehensive drug-free workplace programs for both DOT-regulated and non-regulated companies. Joe maintains a comprehensive database of state laws on drug testing so that the policies he develops are consistent with local and state laws, and also provide for minimum exposure to the employer in their drug testing program. Employee education is about educating the employees about the drug testing policy itself, the dangers of drug abuse, and information about any available drug counseling or employee assistance program services. This educational component can be delivered in many different ways, including educational seminars delivered by substance abuse professionals, local law enforcement officials, company staff, brochures and/or posters, interactive computer programs, video materials, home mailings and/or payroll stuffers, brown bag lunches, or any combination of these. Supervisor training is about educating the supervisors about the policy and providing training for them to recognize signs and symptoms of illegal drug use at work. The main concern of the supervisor should be safety and job performance. Failures in the area of safety or job performance could potentially be a result of employee drug use on the job. The supervisor must be in a position to refer an employee to a reasonable suspicion drug or alcohol test when there are signs and symptoms of drug use. And reasonable suspicion is defined as a belief that an employee is using or has used drugs in violation of the employer's policy, drawn from specific, objective, and articulable facts and reasonable inferences drawn from observations that the supervisor sees, hears, or smells. When a worker has a problem with alcohol or drugs, company employee assistance or union member or labor assistance programs are generally the best places to turn for help since they provide confidential services. Some companies have employee assistance programs, also called EAPs, and some do not. Often, the EAP is included in health insurance. At National Drug Screening, Joe Reilly includes an EAP program of resources for employee assistance with every drug-free workplace policy that he develops. Supervisors and HR personnel should be in a position to help an employee in need get that confidential help. And last but certainly not least, the fifth component of the drug-free workplace program is the actual drug testing. The type of drug testing should be carefully considered, whether it's to be hair testing, urine testing, or oral fluid testing. A properly certified laboratory should always be used, and all drug test results should be reviewed by a medical review officer, often called an MRO. The MRO rules out false positives and deals with confidential prescription information. Drug testing reasons commonly include pre-employment screenings, reasonable suspicions of use, post-accident, return to duty, and random testing. In some companies, fit for duty testing is also required. Most private employers use testing guidelines established by the Substance Abuse and Mental Health Services Administration, commonly referred to as SAMHSA. At National Drug Screening, we help employers with all 5 components of the Drug-Free Workplace program, and we get the lab and the MRO accounts all set up for you. Our new clients can be up and running with a comprehensive drug-free workplace program in just 5 business days. Initial consultation is always available at no charge. Simply call 866-843-4545 for immediate assistance. Again, for immediate assistance, call 866-843-4545.